Welcome to Prescribed by Dr. Nathan Goodyear, where integrative oncology meets holistic healing. This podcast is your home for the latest in innovation, exploration, and elevation in all areas of integrative oncology, medicine, health, wellness, and beyond. Join me and a host of other innovators as we go from practicing to prescribing. Your daily dose of wellness begins now.
Welcome to another hot take by Dr. Nathan Goodyear. Radiation and metastasis. I've long described radiation as a mechanism to promote the metastatic process, what I call the unholy trinity. And it does so by increasing epithelial to mesenchymal transition, promoting angiogenesis, modulating the immune system, altering the tumor microenvironment, pretty much here, both the immune and the extracellular matrix, creating oncogenic metabolic reprogramming, increasing stem cell stemness, increasing stem cell activity, increasing circulating tumor cells, actually promoting resistance, promoting metastasis, promoting local recurrence, and promoting actually new cancers. So here was a study actually published in 2025, check out the show notes, published in Nature, entitled Radiation-Induced Amphiregulin Drives Tumor Metastasis. Now, radiation was first shown in 1953 by Dr. R.H. Moll to actually promote Abscopal effect. This is whereby radiation is treated locally, inducing immune activation locally and spreading that systemically. Abscopal effect, as described by Dr. H. Moll in 1953, it's two words, abscopus, away from target. But here the authors actually describe something different. They call the Badscopal effect. So here it's a bad immune effect, distant, that's being triggered by local radiation. Now this is important because when you look at the pillars of conventional oncology, they are chemotherapy, radiation, and surgery. Now, what's good about radiation, in contrast to chemotherapy, is that radiation has recognized how the wide and high dosing is really, really bad. And so what they've done is they've lowered the dose and they've narrowed the effect, the location, the targeting of this. And here in this study, they showed in humans and in mice stereotactic radiation. Now, I want to tell you that at the Williams Cancer Institute, if somebody has a brain tumor and swelling, we will recommend stereotactic radiation to shrink that. But there's a problem. We'll talk about that in a second. If there's a pathological fracture from a metastatic bone lesion, we will recommend stereotactic radiation to stop that process. But again, the problem is in what we're about to discuss. At the Williams Cancer Institute, we've been able to pioneer and revolutionize and stabilize and create a predictable abscopal effect from intratumoral ablation and intratumoral immunotherapy. The problem with radiation initially was it was very irregular and unpredictable and uncontrollable. So again, abscopal effect is local immune activation triggering a systemic sustained immune response, durable response. But as the authors describe Badscopal effect, so on the opposite end of the spectrum, radiation, again, stereotactic radiation, actually inducing triggering signaling that promotes distant immune modulation, promoting metastasis. Now, they actually describe this as reprogramming the immune cells. You're going to hear a lot of words like that in the future, reprogramming. Cancer reprogram. So if cancer can reprogram, might we unprogram and reprogram back to normal? So here's what happens. Is in the study, they showed in humans and mice, and we'll talk about the mice, it was in a Wilms tumor model, but they used the stereotactic fine point radiation. And what they did is they showed that only the treatment of the tumor cells increased the amphiregulin. Amphiregulin was the biomarker that was released from the radiation of the tumor cells that then modulated the immune system at the distant sites, promoting a pro-tumor immune environment, promoting the metastatic process. The radiation of the non-tumor cells, of healthy cells, did not promote an increased risk or increased release of the amphiregulin. And thus there was no increased distant modulation of the immune system to promote a pro-tumor immune environment in the distant metastatic sites. Now, what's important here is that they actually showed that the radiation actually reduced new distant metastatic sites, but the existing old metastatic sites, guess what? it promoted them. And we're beginning to understand that the process of cancer is very different than what we once thought. Is that we used to think that cancer was a very sequential process. Tumor developed, then it invaded, then it spread, and then it developed metastasis. No. Now whenever invasive cancer is diagnosed, there's distant metastatic sites that are there. We may not see them, but they're there. And some research suggests that this dominant primary tumor, some people call a mother tumor, produces inhibiting signals, endostatin, etc., that keep those at bay. And thus, when you remove a dominant tumor surgically, all of a sudden you can get these rapid metastatic sites that show up within weeks, which though the metastatic process can be triggered by surgery, that's too quick. And so what's happening is you're removing this inhibitory process. But here what's happening is they're showing that simply the fine-tooth focus of radiation on just the tumor cells, which, by the way, that's the goal of stereotactic radiation. It will increase the amphiregulin. This is going to increase and target epidermal growth factor receptor myeloid cells, such as macrophages and neutrophils, modulate them to immune cells that favor a pro-tumor environment and not an anti-tumor environment, that actually create an immunosuppressive environment. So they're going to recruit T-regulating cells. They're going to recruit myeloid-derived suppressing cells. And this is going to create a desert environment where immune cells cannot get in there. You may also hear this as a cold tumor. Approximately 85% of tumors are cold, meaning the immune system, which is the body's defense mechanism, cannot get into the tumor and the tumor microenvironment to target. But what radiation is inducing is this process in the distant metastatic sites, whereby the immune system cannot infiltrate, cannot target these distant metastatic tumors, and thus allowing them to escape the immune system, a key step in cancer growth, survival, and spreading. So here, it's modulating the immune system in different sites via an amphiregulin. It's actually creating immunosuppression by recruiting other cells there. And it's actually allowing for the immune system to escape. These are all key steps by which this study in both showing humans and here in mice model, particularly here in the mice model was a Lewis lung carcinoma model. I think I said a Ewing's, but it's a Lewis lung carcinoma model, where they actually showed that this induced the metastatic process. When you look at chemotherapy, there's been this great resistance to reduce the dose of chemotherapy, going full board with full dose chemotherapy. And it lays great waste and harm to the body and the immune system. If you or a loved one has ever been exposed to full dose chemo, you recognize that. And there's studies that suggest that damage to the immune system may actually be irreparable. In contrast to that resistance in the chemotherapy world, in radiation, they've recognized the risk and they said, well, let's narrow this down. Let's focus this on just the tumor. This study says it doesn't make a difference. It still upregulates the amphiregulin. Only the tumor cells are radiated, not the healthy cells. And this promotes the metastatic process. Now, they proved the positive through that, humans, and in the mouse model. What about the negative? Well, what they then did is they came in and said, well, let's block the amphiregulin. Let's block the CD47, which was also upregulated. Let's block the epidermal growth factor receptor, which was upregulated. Let's block the amphiregulin and the CD47. And they showed that all of that blocked that amphiregulin by irradiation of the tumor cells, inducing the immune modulation of the distant site, actually promoting the metastatic process. So the implications here are significant. Because when we think about chemotherapy, radiation, and surgery, we think, well, let's focus it better. Let's lower the dose. Let's try to avoid damage to the healthy surrounding tissue. And all of that's good, and all of that's admirable. And I think it has helped reduce side effects associated with both chemotherapy, radiation, even surgery. But what's groundbreaking about this study, just published 2025, is that it shows by just focusing on the tumor with stereotactic radiation, it still, through the upregulation of amphiregulin, promotes the metastatic process in distant metastatic lesions. It really changes how I view conventional therapies, and I think how we should view conventional therapies moving forward. See, what it really tells us is that the unholy trinity of chemotherapy, radiation, and surgery, they can have their purpose. And we recommend these at some time. Reduce tumor burden, you got a brain lesion, pathological fracture, as I mentioned. But it's telling us that we really need to change and think differently. We need to move away from this trilogy, because no matter we target the tumor or not, it still is going to promote the metastatic process. And so what it gives us is it gives us a short-term win, but a long-term terminal loss. It sets the stage for metastasis. 90% of morbidity and mortality in cancer is when it spreads. So we may shrink a tumor, definitely good, but we set the stage for the end. This kind of knowledge, this is the science. This is not complementary, this is not alternative, this is published evidence. And so what we as scientists must do is to learn from this and say, okay, in cancer, how can we do better? That's what we do at the Williams Cancer Institute. We don't want a short-term victory for a long-term loss. We want a short-term victory that leads to a long-term life. Longevity. Treatment that promotes healing, that promotes life. Isn't that what cancer treatment's about? It's about living. You don't have to wait. It can begin with treatment. You don't have to sacrifice a long-term gain, a loss with loss of life, again, decrease in progression-free survival and overall survival, because of a short-term gain. Let's not define what's possible. Let's look at anything that's possible and then see where that possibility leads. Maybe, just maybe, it can lead to short-term gain, healing, immune activation, long-term gain, increase in progression-free survival, increase in overall survival, increase in durable immune response, reduction in side effects, and longevity. Why not? Why not? Thanks for joining me on this episode of The Hot Take by Dr. Nathan Goodyear. Again, check out the show notes. You'll see the study there. You'll see the show notes. Read it for yourself. Dive into it. Love to hear your comments here. And please, as always, like, share, and subscribe.
Thanks for joining us on this episode of the Prescribe Podcast. All references supporting this episode can be found on the prescribe.com website. That's pre-scribe.com. To get your next dose of medical innovation, make sure you subscribe to Prescribe. We'll see you for your next refill.